Welcome everybody to the Carlette Christmas Show. This morning we're talking about a subject that many parents have and are really considering, and that is, does my child really have ADHD? And if they do, should I put them on medicine? Well, our guest this morning is Dr. Walt Karnisky. He's been a pediatrician for 40 years, and he has written a comprehensive book, and it's entitled simply ADHD Medicine. Does it work? And is it safe? If you've wondered, then you absolutely want to stay tuned for this conversation. Welcome everybody to the Carlette Christmas Show. This morning we're talking about a subject that concerns millions of parents and kids. It's something familiar to all of us, ADHD. Well, our guest this morning is Dr. Walt Karnisky. He's a medical doctor and a developmental pediatrician trained at Boston Children's Hospital, and he was the director of the Division of Developmental Pediatrics at the University of South Florida in Tampa for 15 years. He's opened a private practice and for 20 years evaluated and treated children with ADHD, autism, anxiety, learning disabilities, just to name a few. Well, he has written a very important book for parents who just still are not sure about what to do and whether or not to put their children on medicine. The book is entitled ADHD Medication. Does it work? And is it safe? Dr. Karnisky, good morning and welcome.
Good morning. It's a pleasure to be here today.
Absolutely. This is a hard conversation for many parents. And I usually don't read the forewords or the beginnings of books like that, especially one like this, because there's so much information. But I love the way that you talk about the three women in your life and how they have added to this incredible work. Your wife and your two daughters, all really passionate about, it seems, children and academia and making sure that this information really translates in a way that parents feel heard and understood. Tell us about that.
I don't know that people truly understand that for physicians, it is sometimes difficult to leave work at the office. And like most physicians, I'll take home some of the things that happen during the day and talk to my wife and kids about it, always using anonymous names, of course. But I think that they benefit from knowing what I've been through during the day and vice versa. One of the things I think that we don't do often enough is listen. Listen to our friends, to our family, and I think that's an important attribute to practice.
Mm-hmm. And so what I like about the book is that you have been a pediatrician for many, many years. And one of the things that you wrote is that the reason why you were actually writing this book is for parents who wanted more than a simple answer to this very complex problem. Tell us about that.
ADHD is an unusual medical condition, and let's talk a little bit about what causes it first, and which will explain why it's difficult for some people to accept it as a true medical diagnosis. I want you to, let's go back 100,000 years and imagine that you're a caveman 100,000 years ago and you belong to a tribe of about 30 people. And your job every morning is to go out and pick berries for the tribe's breakfast. So one morning you're hunched over a bush picking berries, putting them in your leather pouch, and then all of a sudden you hear a rustling in the bushes behind you. What should you do?
Run.
If you run and get back to the cave without the berries, then the tribe's not going to be very happy. And they may kick you out of the tribe. You won't then have children, and you won't be able to carry that distractibility gene to the next generation. A better solution would be that as you're picking those berries and you hear the rustling in the bushes behind you, you turn and look and evaluate the situation. If it's a saber-toothed tiger, then you either run or pull your knife In either case, you'll survive, get back to the cave, have children, and that distractibility gene that made you distracted by the sound in the bushes behind you would go on to the next generation. As time goes on, people that have distractibility were leaders of their tribe. They were aware of what was going on around them and aware of threats. But suddenly, around 1850 or 1870, we started saying to children, they have to start going to school. Children used to be educated by their fathers in the blacksmith shop or on the farm. Now they were educated in schools. And that distractibility, which kept people alive 100,000 years ago, is now interfering with their ability to function in society. So I think it's important to realize that ADHD is not a disease in the same way that multiple sclerosis or Parkinson's disease is. And let's actually take a look at some of the symptoms of ADHD.
Okay.
There's symptoms like difficulty paying attention, easily distracted, not planning for the future, lack of organization, loses things, forget things. Have you ever experienced any of those behaviors?
Mm-hmm. Sure.
I would suspect that all of us have expressed those behaviors at some point or another. But let's take the symptoms of a stroke, for instance. A person suddenly has difficulty with their balance and their coordination and walking. They can't talk. Their eyes are not focused on things. One part of the face is drooping. Would we ever consider those behaviors to be normal behaviors?
No.
No. Yeah. So all of the behaviors of ADHD, while they are significant enough to interfere with a child's ability to learn, they're not necessarily abnormal behaviors if they occur occasionally and once in a while and can be compensated for. But suddenly, because we put children in school and force them to sit in rows and keep quiet and only act and talk when they're called upon, they have difficulty. So that person with the lack of speech and the drooping face, it's easy to say that's a disease.
Mm-hmm.
It's harder to say that ADHD is. And yet we have three incredible sources of evidence that ADHD is a true medical condition, if not a disease. And would you like me to kind of go through those?
Let me do this, Dr. Karniski. Let's take a break here, but when we come back, I'll let you go through that. And I also want to talk about, for those parents who, all of the symptoms that you talked about, they are now being told by teachers that their child needs to be on medication. Stay on point. This is an important conversation. We're back right after this. Welcome back, everybody, to the Carlette Christmas Show. Our guest this morning is Dr. Walt Karnisky, and he's written a very important book. It's entitled ADHD Medication, Does It Work and Is It Safe? And that's a real big question. But before we went to break, you were taking us through sort of the chronology of what it is and how it came about. And now our kids are in classrooms. And during the break, you and I were talking about teachers really spending more time with kids during the course of a school day or a day, and sort of making suggestions that this could be hindering their learning. What say you about that?
Well, let's go back to that situation that I described a few minutes ago, where we're back in cave days time. Mm-hmm. I basically felt, as a physician, I had three options when I'm dealing with a child who's having difficulty focusing their attention and directing their attention. One would be to invent a time machine and go back in time so that that child would be in the environment that he could excel in. Obviously, I've not been very successful with time travel, so that option is out.
Right.
The second option is to change the way children are educated. Currently in this country, we educate children by explaining to them what we do as a teacher in the classroom, and then tell them if they can follow directions, stay in their seat, offer intelligent responses to questions, that they will get a good grade.
Mm-hmm.
If they don't, then they maybe should go somewhere else. And I think the point here is that we tend to teach a certain way, expect the children to learn that way.
Mm-hmm.
Instead, if we could design schools so that we would teach the way they learn, then we would have a better response and maybe not need a medical approach to this. But of course, I can't change all the schools in the country. And I did put together 3 schools here in Tampa and elsewhere for children with ADHD, and they've been very successful. And at times, it has been possible to educate the children without medication. But let's talk instead about the evidence for medication being effective, because that's my third option.
Right.
Every year across the world, there's approximately 350 research studies done on the effect of medication. These studies overwhelmingly show that medication has an immediate short-term benefit. When children take it within a half hour to an hour, we begin to see positive effects, increased ability to focus their attention, increased ability to learn, and to retain information. So the first line of evidence is 350 studies a year that show us that medication for ADHD is effective. The second area is to look at what happens when children grow up with ADHD and become adults. And I think this is extremely important, and this is going to be hard to hear, but we know that children in school who have ADHD are less likely to learn. They're less likely to get lower grades. They're more likely to be retained. They're about 8 to 10 times likely to be retained than children without ADHD. But that has effects. But those children who have been treated with medication don't have those difficulties. In other words, children who are treated with ADHD with medication get approximately the same grades as children who don't. They do as well in school. They're just as likely to attend high school and college. But if children are not on medication, they're more likely to drop out and not attend those schools. But we found that children who took their medication could not be distinguished from those children who did not have ADHD.
Let me stop you right there, though, because a lot of parents are saying, what is it about this medication that changes that child so dramatically that they go from a child that can't focus, can't be disciplined, can't, to one that can?
Well, in the book, I give about an 8 or 10 page description of what is happening in the brain. I can't do that right today with our limited time. But what I will say is that children who have ADHD have been found to have chemical differences in the brain in the way they process information at the nerve ending. And the medication normalizes that imbalance. And so we actually see evidence that the medication is working specifically in the areas of the brain whose job it is to focus attention and to plan for the future. So I was going to say the third area, approximately 10 years ago, we started doing studies in which we would scan the brains of children with ADHD and compare them to children who do not have ADHD. And what we found was that there were 3 areas of the brain that were smaller in children who had ADHD. Those 3 areas of the brain, I won't list them, but their 3 jobs are to focus attention, to help learn and retain memories, and to pay attention, and to organize ourselves and plan for the future. All of the symptoms of ADHD. And yet those 3 areas of the brain are smaller in children who have ADHD. But here's the amazing thing. What I didn't realize until about 10 years ago was those studies followed the children for more than 10 to 15 years, and they would rescan them as adults. And what they found was that children who had ADHD, who became adults, who were never treated with medication, continue to have small areas of the brain in those 3 areas that we just talked about. Mm-hmm. However, those adults who had taken medication as children had normal-sized areas of those areas of the brain. It was almost as if the medication had enhanced the development of those areas of the brain. And we see that with working out in the gym. We work out and we use muscles that we haven't used before, and the muscles get larger and more functional. And that seems to be what's happening in the brain. This has not been proven, so I don't want people to go out and say Dr. Karniski said that ADHD normalizes brain function, but there is good evidence that something along those lines is happening in the brain.
Now, we're talking about the medication and whether or not it works. Many parents have said, and you give a litany of medications in the book, and you even talk about how those medications work and such. But many parents would say, when I put my child on the medicine, they became lethargic. They were listless. And you write a lot about the medications. We'll take a quick break here, but when we come back, I want you to speak to that and talk about those concerns that parents have about whether or not to place their kids on the medication, and are there long-term side effects? Stay with us. We're back with more right after this. Welcome back, everybody, to the Carlette Christmas Show. Our guest this morning is Dr. Walt Karnisky, and he's written a book that is really fascinating and important and chock full of information, especially if you're dealing with ADHD and whether or not to place your child on medicine. The book is titled ADHD Medication, Does It Work and Is It Safe? And before we went to a break, Dr. Karnisky, I was asking you about all of the many variations that people have when they're deciding whether or not to place their child on medicine. Is it going to really work? Is it going to make my child, or has it made my child lethargic? And what do you say to parents about all of the medications and what they can expect, and how are they? You know, you talk about the brain size and the studies and the good effects, but what about those parents that are seeing effects that don't feel so good and don't look so good initially?
Carlette, that's probably one of the most important questions that I could be asked about this topic. In the book, I use a lot of stories, true stories from my practice, and some fictional stories as well, to help delineate what the problems are so people can understand how it would work in their home or in their environment. There's two stories that address your question directly, and I really feel compelled to tell those two stories. The first is a 12-year-old girl, for purposes of anonymity, we'll call her Michelle. And she came in to see me when she was 12 with her parents, diagnosed with ADHD, started on medication. I scheduled her to come back 3 weeks after starting on medication, and I never heard from her again. 7 years later, I'm sitting in my office eating lunch, looking at the list of patients that I have for the afternoon, and I see her name on the list. And I said, what is she doing here after 7 years? So she comes in, she tells me she came in without her parents, that she said, I'm 19 years old now, and I can make my own medical decisions. So I'm here to talk to you about the medication that you put me on. And I said, well, Michelle, what happened when we started you on that medication? She said, oh, Dr. Karniski, when you started that medication, I hated you. I said, what do you mean? And she said, well, my friends told me when I was on the medication that I was too quiet. I wasn't as much fun to be around. I used to be the center of the party. I would tell jokes, everybody would laugh, we would giggle all the time. But when I took that medication, they told me I was too serious. So I stopped it and continued to have difficulty in school, but I didn't have those problems with my friends anymore. Then she said, so I started her back on medication. We talked a little bit about that side effect. She came back and I said, how are things going? And she said, well, I'm doing great in school. I used to be getting C's and D's, and it took 6 hours for me to do my homework. Now I can get it done in 2 hours and I'm getting straight A's. I'm really happy with the way things are going in school. And I said, well, what about your friends? And she said, Well, that's the weird thing, Dr. Karniski. My friends tell me that I'm nicer to be around when I'm on my medication. They say I listen better, I don't interrupt. And so I used to talk about myself all the time. Now I listen to what they have to say. And they tell me I'm just a better friend. So what changed in Michelle between the time that she was 12 and the time that she was 19, a freshman in college now? Well, the answer is nothing. Nothing changed about Michelle. Her response to the medication was the same in both circumstances. The difference was the expectation of her friends. They wanted her to be the life of the party when she was 12, but at 19, they wanted her to listen and be a good friend.
Mm-hmm.
So to me, that is emblematic of what the medication does. And the problem is in the interpretation of what's happening. So let me tell the second story to explain what happens with that interpretation. I saw a 9-year-old boy diagnosed with ADHD. We did the whole workup, tests and everything, started him on medication and saw him back 3 weeks later. I sat down with the mother and said, "How are things going?" She said, "Well, in school, he's doing great. He's got great grades. The teachers say he's a model student. But at home, he's depressed." And I said, "Oh, depressed? What do you mean? Why do you think he's depressed?" And she said, "Well, it used to be when he came home from school, he would drop his book bag on the floor, run to the family room, flip on the TV, knock over the lamp, pull the cat's tail. And within 3 minutes after he walked in the door, the house was just chaos."
Mm-hmm.
And I said, "Well, and now?" She said, "Well, now he comes in, drops his book bag on the floor, goes to his room and reads for 2 hours." And I said, "And why do you think he's depressed?" And she looked at me like I was crazy. She said, "Well, Dr. Karniski, he's never done this before. He doesn't act like this." And I said to her, "But what you're seeing is what your son would have been if he didn't have ADHD. Would you have been concerned if your son had always, from the time that he learned to read, always read for 2 hours after school?" And she said, "Well, no, of course not." And I said, "That's the difference."
Mm.
And again, it's a matter of expectation. This mother thought he was depressed because he was acting like 10 million other children, but not like the child that he was before.
Mm-hmm. And so what about those parents that have placed their kids on medicine and they find that they are lethargic and they vacillate on, okay, needing to keep them on a medicine, and when can I take them off? Like for the summer, can I take them off? Because they're just too, and would that have been their personality? Were their brains formed and functioning the way that they would have been before ADHD came into play?
I believe the answer to that is yes. The research shows that, and my clinical experience is yes. But the medications are not without side effects, and the side effect that you're talking about, the lethargy, is what most parents refer to as the zombie effect.
Mm-hmm.
That it creates zombies, and I contend that all it's doing is allowing us to concentrate and focus the way we were meant to concentrate and focus. It's not giving us superpowers. It's not changing our personality. It's simply giving us abilities to perform in different settings that we did not have before the use of that medication.
Mm-hmm. And when you start this medication, start kids on medication so early, we're in a culture now where drugs are pervasive. Is there a chance of addiction in any realm when it comes to these medications?
That's a great question. And you would suspect that there might be potential for addiction. But the problem is when children take this medication, they feel relatively normal. Most kids, when they take it, and we have problems with adolescents keeping them on their medication because they say that the medication isn't doing anything. They don't feel any different. And yet their grades have improved and their friendships have improved, and their relationship with their parents at home has improved.
Mm-hmm.
And yet they don't see that. What they see is that medication didn't really do anything to them. And they pretty much attribute their improvement to their own behavior,
Mm-hmm.
which is fine, which is what I prefer for them to believe, because that's the truth. Medication doesn't force a child to behave in the classroom. Medication gives the child the ability to focus and concentrate and attend if he or she wants to.
Mm-hmm.
But if he or she wants to be the life of the party, they can still do it. So medication does not cause zombies. It does not cause depression. However, I will tell you that when we talk about side effects, there's three major kinds of side effects: dose-related side effects, specific medication side effects, and idiosyncratic side effects. And let me explain what I mean by that. The first side effect is a dosage effect. So the more medication you give, the more likely you are to have side effects. So if medication decreases impulsivity, what do you think it does to spontaneity? It also suppresses spontaneity.
Wow.
But if you look up spontaneity in the dictionary, it says to do something impulsively. So impulsivity and spontaneity are about the same thing, with one exception. Spontaneity is doing something without thinking about the consequences, but with good results.
Mm-hmm.
And impulsivity is doing something without thinking about the consequences, with bad results.
Mm-hmm.
But to really in the brain, they are functioning the same way. So medication will have the same effect. It will decrease impulsivity and will also decrease spontaneity.
Wow.
But spontaneity is sometimes the problem. If you go to a party and your husband says something to the next door neighbor that's insulting, he may have done that because he wasn't thinking about the consequences of that.
Mm-hmm.
And so we all engage in spontaneous and impulsive behavior.
Sure.
And what I think the medication does is give us the power and the ability to think things through before we talk, before we act.
And
so children with ADHD do and then think later. And I think the perfect example of this is a 7-year-old child that I saw at one of the schools we had started. He had gotten in trouble the day before because he told his teacher to shut up. The next morning, he got in a lot of trouble. The next morning, he walks in with a letter and he hands it to his teacher and goes back to her seat. She opens the letter and reads it, and it says, "Dear Mrs. Miller, I'm sorry I told you to shut up yesterday. Sometimes things just blurt out of my mouth, and I don't seem to have any control of them. I'm really a good kid. I can be the best kid in your class if you give me another chance."
Wow.
And that letter is reprinted in the book as well. To me, that sums up everything about what these medications are doing. It's giving children the power and the ability to be the kid and the adult that they want to be.
And the next question before we leave the conversation is, will children that become young adults and then adults have to continue to medicate or take medicine, or will they somehow grow out of ADHD?
Well, unfortunately, the answer to your question is we do not outgrow ADHD. However, some people with ADHD as adults can excel without medication if they marry the right person who remembers to pay the bills on time, if they get a good executive secretary, if they have a job that doesn't require focused attention to detail. So that job may involve being out with people all the time and interacting with people, and people with ADHD do that well sometimes, and maybe medication wouldn't be needed at that point, but in many cases it is. As a matter of fact, follow-up studies have shown that people with ADHD make $10,000, on the average, $10,000 less than people without ADHD. They found that people with ADHD as adults are more likely to be in car accidents. They're more likely to be addicted to drugs if they don't take their medication.
Mm-hmm.
If they do take their medication, all of the behaviors that I just mentioned occur in equal propensity for those people who do not have ADHD. So in other words, children with ADHD are 4 to 6 times more likely to be in a car accident, and the car accident is more serious than children who are in car accidents without ADHD. But if they take medication, their incidence of car accidents is about the same as children who do not have ADHD.
Mm-hmm.
So to answer your question, should a child be on medication during summers and weekends and as adults? And the answer is, well, if they're driving, absolutely.
Wow.
And if they are working and are responsible for attending to detail, then absolutely they should continue that medication.
Mm-hmm. You know what I really liked about the book, and I go back to the dedication and your daughter who came out of business and became a pediatrician, and you talk about writing this book with such empathy and really understanding where parents are in making this, what really in that moment seems like a monumental decision. First of all, getting to the diagnoses that my child does have ADHD. And then secondly, the guilt that all the parents talk about in the book about having to put them on medication. But you give such great data and stories, and we can kind of see your practice over the years and really, really feel that you feel as a physician and as a father that parents that will have to put their kids on medicine and those kids will be okay. You know, and I think that that's what most parents want to know when they're making this decision for their children, that their kids are going to be okay.
Exactly. I don't know if you remember, but one of the stories I told in the book was about my change as in dealing with this as a physician.
Mm-hmm.
I actually started out as an engineering student.
Mm-hmm.
I wanted to design planes, and I switched from engineering to pre-med in my sophomore year. And what I found was I began reading about ADHD even when I was in college, and I was appalled that children would be put on medication for this problem. And as time went on, as I started seeing children with ADHD, my goal was to get them off medication. And yet, every time I would take them off medication, I would see their behavior get worse, their listening get worse, their grades would drop, their friends would stop interacting with them. And I began to realize that the medication was really helping them in dramatic ways that I hadn't considered, and that we were not taught about in medical school. We were taught about pneumonia and appendicitis and cancer,
Mm-hmm.
but we were really not. I think we got maybe one lecture on ADHD. And yet every physician, every pediatrician sees probably 5 or 6 kids a week. Wow. With ADHD in their practice.
Wow. I think that it's great information, and it really will help parents that are dealing with the uncertainty and the fear and the frustration of what to do, and your empathy comes across in the book, and it comes across in this conversation, and it gives parents a real professional opinion, of course. And you say in the book that you are not leading people to one thing or another, that they do need to consult with their own physician, but it is really, really an eye-opening and enlightening book. Thank you for the work and the time that has gone into ADHD medicine. Does it work, and is it safe? Before you've got to go, tell people, first of all, how they can get the book and how they can come to your site for more resources and more information.
Okay. The book is available at Amazon.com and BarnesandNoble.com. You can also order it directly from the publisher, Roman and Littlefield. You can also look at my website. And I will tell you, we started putting this website together about 2 weeks ago, and it's not complete yet. But it does have a number of the interviews that I've done before. It has a summary, a chapter summary of all the chapters in the book, and an explanation of what we're doing with the medication. That website is ADHDmedicationbook.com. ADHDmedicationbook.com.
And so when you finished this work, Dr. Karniski, were you pleased? Was it satisfying to you? Because you really gave a lot of information, and not only could we feel the information, but we could feel your heart.
Not only did I feel better when I was finished with the book, but I slept better. My wife told me that I wasn't thrashing around in bed as much as I was before, that I would kind of rehash things that we're going to work on the next day. Mm-hmm. Once the book was complete, I slept more soundly.
There you go. Thank you, Dr. Karniski. Thank you for the work, and thank you for taking the time this morning.
Okay, Carlette, this has just been a pleasure. Thank you for inviting me.
Indeed. ADHD medicine, does it work, and is it safe? Dr. Walt Karnisky has been our guest. Stay with us. We're back right after this. Welcome back, everybody, to the Carlette Christmas Show. We'd like to thank you for maybe spending the first part of your morning with us. And I know when conversations like this happen, there is still a little bit of doubt and uncertainty about whether or not you should put your kids on ADHD medication. The book is an easy to read book, and he gives a lot of information that could pertain to you and to your child in your situation. And so pick it up. It's called ADHD Medication, Does It Work, and Is It Safe? The thing that really caught my attention was that a pediatrician that has been practicing for really more than 40 years and has seen the gamut is saying, without a doubt, it works, it's necessary, and it's important to understand. The reason why we do it every single morning is simple. We love you. God loves us all, even more than that. He made doctors so that we wouldn't have to figure all this stuff out. And so look at the research, look at what he's saying, and make an informed decision for you and your family. Stay safe and well, God willing. We'll see you right back here next time.